Welcome. My name is Corinne Waldo. I'm the Senior Director for Economic Vitality at the Boulder Chamber. I want to thank you for joining us for this special session, a specific update for landlords and office-based businesses. We're going to get started right away with Boulder County Public Health, but I do want to ask you to put your questions in the Q&A feature. We do save the chat for pushing information to you. It's a lot easier to filter all the questions through the Q&A feature. At this time, Jesse, go ahead and take it away.
Thanks, Corinne, and thanks everyone for joining us. I will jump right in so we can get to questions. Just starting out, it's not advanced. There we go. Just going to do a quick epidemiological update, talk about the state dial, and then we will get into the orders that pertain to landlords, as well as sick employee information and some other details before we get to questions. So just quickly, this slide is from earlier this week. The rolling average, I do believe, has gone down slightly. But again, we are probably in a lull between the peak that occurred before Thanksgiving and then the results of the Thanksgiving travel season. So we do not expect to see a continuing decline there. In terms of our key takeaways from the epidemiological side, the case numbers remain high. We are seeing age groups diverging, which is an interesting change. And hospitalizations are increasing statewide as they are locally. And testing continues to be stable while positivity is rising, although it has in recent days stabilized at an elevated rate. We are still in severe risk red, and we'll talk about what that has to do, the consequences of being in red in a moment. In terms of where we are with the three categories that are looked at to decide where you are going to be in the dial, we are at 708.5 per 100,000 two-week cumulative incidence rate. That is better than it was earlier this week and better than it was last week and the week before. So we are headed in the right direction, although it is still double what we would need to go to orange, to go back to orange. In terms of our two-week positivity rate, it is stabilizing. We were seeing up in the 8% range, and now we're seeing around the high 6%, just about 7%, and that's been about the same for a little over a week. So that's can be good news there. And then unfortunately our hospitalization rate, we've actually gone down to 6 days of decreasing or stable admissions to the hospital. That is a not good sign. This is one of the metrics that they use, and we, before the recent peak, the recent spike, and then also during the early days, we were still in the 10, 11, 12 days of decreasing or stable admissions. So we're headed in the wrong direction there. In terms of hospitalizations, we saw back in late October, early November, we saw a spike, and then there was an odd drop, but that drop was short-lived. And so, yeah, we're seeing that hospitalization rate increase. And that's not a good sign. A lot of people have been asking about level purple and what it would take to get to level purple. Level purple has nothing to do with the metrics, the three metrics we just shared. It is really a recognition. If we move to level purple, it's a recognition that our hospital system and our healthcare system is overwhelmed. And at this stage, all of the indications for Boulder County are that we are not headed in that direction. We have no hospitals headed towards a crisis designation, and they're not using alternative care sites. They have enough PPE, they have enough beds. The one thing that we are continuing to see shortages of is personnel, and that can have knock-on effects long term. Obviously, if we have fewer people serving an increasing number of sick patients, that's a bad thing for those people. It's a bad thing for the community, and it can lead to all the shortages that we're hoping to avoid. So while it's generally unlikely we move to level purple at this stage, we do see some strains in the system. So jumping to sector guidance, this is a much shorter set of sector guidance. I don't feel like we need to go through all of them. I tried to focus on the specifics that might have to do with office-based or larger buildings with multiple businesses in them. So again, starting out and just saying that public and private gatherings of 2 or more households are prohibited. And this is a thing that has caused a bit of confusion, so I will try to dispel it now and then get into it again later. These public and private gatherings, this note is really for things that don't fall into another category. So if you're having a business meeting, that is not a public or private gathering. That's a business meeting happening in an office-based environment, for example. So for non-critical office-based businesses, you need to operate at 10% of posted capacity. And I'll get into that in a moment. For non-critical retail, you're at 50% posted occupancy. For non-critical manufacturing, you're at 25% or 50 people. And then field services, really want to note here, and I think I bring it up later again, field services are closed. However, for businesses, you know, that like an office park or a building again with multiple tenants, services that are required to maintain that building are allowed. So snow removal, custodial services, those sorts of things are allowed to continue. So that's, please don't assume that because field services are closed, you can't do any of those maintenance type activities. So jumping back to how to calculate occupancy. So for office-based businesses, and again, this is all non-critical office-based businesses, and I'll get into that in a little bit. Every building has a fire code capacity, and every room in that building should have a fire code capacity if you are open to the public. That's something that's set by your land use department or by your fire district, depending on whether you're in the municipality or in the unincorporated county. But so all of that exists. You can reach out to your fire district for that information. They should have that on file. Also, any larger room should have it actually written on the wall. It should be a placard placed on the wall. I believe that's actually code, but that is accessible. If you can't find it easily and you're just looking for a general idea of what your capacity should be, using the social distancing calculator will give you a stricter but good idea of what your capacity would be at 10% if you know the size of the room and generally how full of things it is. But to this, I really want to point out that if you have a building that has a number of office suites where it's just one office, each suite is one business with one office in it, that office is allowed to have at least one person in it and should be able to have, based on the capacity, probably 2 people in that. So you could have a person behind a desk running a law office or an accountant, and they could have a client in the office. So when you have a capacity, it is not for the entire building, it is for each room in that building. So yeah, I think I just addressed that each suite can operate at 10% capacity. Really important here, it is a good idea, and it's recommended in the guidance that you close shared use areas, obviously other than bathrooms, but things like cafeterias, break rooms, those are great places where people forget to social distance. They can touch things that someone else touched. Not that surface transmission is all that common, but it is a good idea to avoid it. It's also a space that you don't have to clean as regularly if it's closed. So that's a good thing. And to my point earlier, businesses may continue in-person meetings. The one thing I want to mention here is staff meetings are a bad idea. It's hard to maintain social distancing. You have to think about the capacity of the room you're in. Everybody would need to be masked. So we really do encourage you to avoid meetings if possible, but they are allowed under the orders as part of operating a business. So nothing in the orders says having a client meeting is not allowed as long as you follow all of the guidance. And this is my point about field services again. Actions necessary to maintain an open office may continue snow removal, custodial services, maintenance, that sort of thing, all allowed. Critical businesses. You'll note earlier I mentioned a couple times. The guidance from the state is really focused on non-critical businesses. For critical businesses, you must follow sector guidance unless doing so would make it impossible to carry out critical functions. So as landlords, you can find out if a business that uses your space is a critical function or a critical business. It's in Appendix A of the Public Health Order. It lists all of them. And those businesses can make a claim that they would need to have more people, for example, but they do need to follow all of the social distancing, mask wearing, all of the cleaning, all that stuff needs to continue regardless of whether you're a critical business or not. And they should try to minimize the number of people in the office as well. Yeah, like I said, employees in critical operations must follow all guidance. The hospital point and the first responders point should not apply to most of you. We're not talking about healthcare facilities. We're talking specifically about hospitals in that note there. Jumping to sick employees, I put this in here because I think it's important that we all understand the guidance there, and I try to put it in as many of our presentations as possible. If you have a single sick employee, you do not need to shut down. Send that sick employee home, inform staff of the possible exposure. You cannot violate that person's privacy by saying, this individual, but you can say we had to send a sick employee home. And if you were, and then you do need to do the close contact searching with your HR department or whatever. And then once 24 hours have elapsed, you do need to clean the workspace of the employee who went home sick. So what is a close contact? A close contact is anyone who was within 6 feet of a person who tested positive for more than 15 minutes in an entire workday. So that could be 2 minutes at a time over that entire workday. But if it's 15 minutes, they are considered a close contact and they will need to quarantine. And I will get into quarantine in a moment. A contact of a contact is not a close contact. So in other words, if you have if you have an employee whose partner is sick or someone in their household is sick, they are a close contact of that person. But anyone who was in contact with your employee who has not tested positive is not a close contact. So quarantine versus isolation. Isolation is for people who have tested positive. They must go 10 days plus 24 hours with no fever, basically. So you need to go 10 days, and then if you still have a fever, you need to stay in isolation until it's been 24 hours since you've had a fever, and that can't be drug assisted. And during that isolation, no contact with others. Close contacts must quarantine. Quarantine is different, and they just released a change in the quarantine regulations, which I will try to go over and happy to answer questions about it. But right now, the state and the county are still recommending 14 days of quarantine for individuals who are close contacts, who have not tested positive, and who may be asymptomatic. You need to quarantine for those 14 days. Now, the CDC just released an alternative to this, and the state and county are likely to adopt it. So I want to try to explain it as best I can. If you are a close contact and you have no symptoms, you may quarantine for 10 days instead of 14. And you must remain symptom-free for that entire 10 days. You may also, after the 5th day of your quarantine, get a test. And once that test comes back negative, if it comes back negative, and you still have no symptoms, you need to wait 48 hours after receiving your negative test. If after those 48 hours you've received the results of your negative test and you still have no symptoms, you can leave quarantine. So the minimum possible is 7 days for that test. And it does have to be the PCR test. It can't be an antibody test or something like that. It has to be a PCR test. And and again, we are still, the state is still, and CDC are still saying, if you can quarantine for 14 days, that is your best bet. So please try to quarantine for 14 days. It's the best way to keep other people safe as we go forward. So now skipping back to outbreak guidance, if 2 or more employees test positive in a 2-week period, you may have an outbreak. Close the business for a day, contact Boulder County Public Health, and we will work with you. You may be able to reopen within a day if we can establish a way to do that safely. So now I'm nearing the end and getting to questions. Just want to remind everyone the exposure notification system is available. Still need to change that link. Going to do it by next week, I promise. It's add your phone, add my phone. The link, Corinne will send out a better link, but at any rate, the free voluntary service basically uses the Bluetooth in your phone to identify when you've been in close contact with someone else who tested positive. It can give you a jump on quarantining, make your family and your coworkers safer. Finally, we are starting a new schedule next week. So our general update session is going to Thursdays at 1 p.m. and we will hold this time on Fridays available for any as necessary, as needed conversations. The Spanish language session will continue to be on Thursdays that we release in collaboration with the Latino Chamber. And with that, happy to take questions.
Okay, so we have a couple questions that came in, and then I think there's just a little bit of confusion around that shared use. You said closed shared use spaces. So around that shared use spaces, there are different types of shared use spaces within different types of facilities around town. You say that meetings can still happen, but what if a shared use space is a shared conference room within a building that is used by multiple tenants?
Not a good idea. If you're doing staff meetings, I mean, again, there's nothing in the order that says that conference room has to be closed. However, the orders would say that it has to be cleaned thoroughly between each meeting.
What if that's the only meeting space that's available for these individual office spaces?
I would recommend meeting virtually.
But there's nothing in the order that prohibits from meetings to take place, is what.
Yeah.
But there needs to be cleaning between. If it's a shared space, there needs to be a cleaning regimen that happens between each of those meetings, which is, I think, the issue that arises when it's a shared space.
Yep.
Like a shared, the cafes, the lunchrooms, all those things. Those are all the things that are closed and so forth.
And also remember that meeting room has a capacity and you have to be at 10% of whatever that capacity is. So I mean, there may be some large facilities that you could have multiple people in, but most conference rooms probably can't fit more than 2 people in them at this stage.
Okay.
I would add for meetings that would have to be very specific to an office business versus something where people want to use a space as a group gathering, which is prohibited.
So a necessary meeting. I think one of the issues that arises is because we have on the call landlords that have many different types of businesses. You might have a legal and an accounting and a tech company all within the same roof, and those all are operating very differently. And you might need to take a one-on-one legal meeting, whereas you could probably do an online call with a different type of meeting online. That's a very different type that can be done online. So I think this is confusing because the orders are different depending on the industry. You have critical businesses, not critical businesses, and I think we have a lot of navigating that needs to happen here. Question now is, what are the landlord responsibilities on signage within the building?
Great question. So you need a mask required sign at the front door, and then each separate business suite at their door needs a masks required sign.
How about shared bathrooms, or whose responsibility is on those bathrooms? Whose responsibility is it on the cleaning schedule, and which cleaning schedule, depending if it's a multi-use facility, what cleaning schedule do you have to follow?
So I don't know whose responsibility is. That's probably written into the lease. I don't know that. But in terms of cleaning, there are in the public health order, and I don't have the number right in front of me, but it does say for bathrooms, there's a note, you need to clean much more regularly than normally would. There isn't, I don't think there's a, clean every hour type guidance on that, but I will take a look in the orders as we ask questions.
Yeah, for restaurants, it does spell out every hour, but I don't think for office spaces, it's mandated to be at that frequency, but it would be kind of depending on use.
Okay. And you kind of went through the outbreak and sick employee guidance. Are there any responsibilities for tenants to let their landlords or anybody know about anything having to do with an outbreak or sick employees within the facilities? Or is that something that needs to happen? Or you brought it up, but I just wanted to just be clear as to whether or not that's something that they need to be aware of.
It would be a case-by-case basis, which I know is not an easy answer or an easy way to answer that question, but it really would have to do with what are the chances that a close contact would have occurred between the sick employee of X business and the employees of Y business across the hall. If it's something where tenants access the building from outside and don't interact, then it's unlikely that anybody was a close contact. However, if you have shared spaces open, there's always that chance. If everyone's using the same break room, there is always that chance that a close contact happened. That's why we recommend closing break rooms, making sure that you're not having people sitting down to lunch together, that sort of thing.
So what happens if multiple tenants in a shared building test positive for COVID? Will the building be shut down?
It's unlikely unless we can establish close contact. So what we're looking for in an outbreak, it's not just that we're looking for the number of people who get sick. We're looking to try to understand the transmission that happens. The way we talk about it in a lot of our sessions is, say you have a large corporation and someone in shipping and receiving and someone in the HR department test positive and they never interact. They're on opposite sides of the building. That's not an outbreak because there was no connection between those two. There's no larger transmission, at least as far as we can tell at that point, within the organization. So again, if you have a building and there's no interaction between the two people who get sick, regardless of who they work for or how often they interact, if there's no interaction between the two of them, then it's not an outbreak that would shut down the whole building. However, if you had like a co-working space, is a good example of one where it's harder to manage maybe interaction, and it turns out that they are sitting together or sitting near each other in an open office format for more than 15 minutes, then that's an example of a situation where, yes, the whole space could be shut down.
I got a request to put the public health order in the chat, so I put the latest revision of the public health order in the chat. Please note that we are in level red, so you'll follow the level red part of the order, and anything listed as a critical business is in Appendix A. So Appendix A is where it's listed as critical business. So I wanted to note that. The recording for this will be made available, so that'll be on a YouTube and I will send it out. What about shared kitchens or entryways? How do you deal with those?
So again, shared kitchens, not a great idea. I don't know exactly what the situation is, but yeah, shared kitchens, break room, that sort of thing. It's not advisable. Too much chance for long-term contact or enough contact that you could transmit the disease. For shared entryways, unless you're so this is the thing that we deal with a lot with some of our limited healthcare and personal services businesses. If you have a shared entryway that has a shared lobby where people wait to go into an office, that's not advisable. Having maybe some sort of online scheduling so people can just come in and go straight to your office is advisable. If you're just talking about sort of a shared lobby where people go to their offices right from there, it's unlikely that anybody would be together for long enough to create a transmission risk.
As with other industries, people have taken out lobby furniture or closed off lobby furniture or spaced out lobby furniture in a lot of cases. In break rooms, some cases there is no other place to go. So in best practices in some of the other industries, you've spaced out the tables or crossed off chairs, increased cleaning schedules. So if there's an absolutely necessary allowed only two people in a rather large space at a time. I know there's some best practices in some other industries when there's absolutely nothing else you can do and there's no other place for your employees to go, especially as we get into the colder seasons. If our county is in red, its levels are how long will we be in red? I think is the question.
We will be in red as long as the metrics say we need to be there. So that's a sort of flippant way of answering the question. So I'll try and go into a little bit more detail. To move out of red, we would need to attain and maintain the metrics for level orange or level yellow. So we would need to reach that level and then stay there for at least 2 weeks before we could be moved back to orange or yellow. And that's for every level all the way up to protect our neighbors. And so that's moving up and moving down. If we were to go back to orange, we could move back to red much more quickly. They're not necessarily looking at, okay, here's 2 weeks, here's another week of figuring it out. They're moving people more quickly, as you all saw when we moved to red, and in fact when we moved to orange as well. So it can happen quickly.
Okay. Is the conference room occupancy determined by the social distancing calculator? Because that's not the office space. Or is there another way to determine the occupancy of that meeting room area?
So, well, I mean, it sounds like maybe this is an unusual space because if it's a room, it has an occupancy set by fire code and by the fire district or land use department for your municipality. If it's just a large open space where people meet, it should still have an occupancy. Each room should have an occupancy limit set forth in the code. But if you need to get an estimate of what the space is, using the social distancing calculator is a good idea.
Well, and I'll use the example. So at the Boulder Chamber, our occupancy for our upstairs conference room is about 90. And when I'd use the social distancing calculator with the tables in there, we were able to fit 8. So, and the social distancing calculator gives you 12 square feet around each person. And I think it's just giving that idea that, with furniture and distance around people. Now, again, you're pointing out you're not having a personal gathering, you're not having a gathering. This is for making sure you're maintaining the occupancy and not having a gathering. But that just gives people an idea. When we looked at our occupancy versus the social distancing calculator, it was pretty close.
Yeah, that's really good.
All right, but looking at if you have multiple conference rooms and share, within a space, how do you take into account your conference rooms and your office space and that 10% occupancy?
So that's a great question. For a larger space, it is your occupancy is that whole, like if an entire building is your office, then your occupancy is the larger, it's probably a per floor occupancy. But the way that the state has laid it out, it says post occupancy, so it's technically per room. I don't know if that really helpfully answers your question. It really depends on the space we're talking about. If it's a large, so for example, if it's a large open office concept, it's 10% of that room's occupancy. If on the other hand, it's a bunch of small independent office suites, it's each one of those offices occupancy.
So, can you give examples of some field services that might be closed right now?
Sure, maybe. I mean, I think basically things like doing, I don't really. I think that the big one is open houses for real estate sales have to happen in a very specific way. So closed may be a little bit extreme, but basically it's reducing the capability of doing sort of larger events outdoors for field services that is the change. I can't think of a single one that would be totally closed, impossible to open. I don't know if either of you two
can. I'd have to look it up.
Maintenance, outdoor pool maintenance. Please don't do outdoor pool maintenance right now unless you have a heated pool and you run a rec center, I guess.
Okay, so we have a tenant on the call who said that their landlord and maintenance person has an access key and can enter the building, but they often come in without warning, without a face mask. Do they have any resource or recourse that they can take, because they feel uncomfortable when they enter without?
Absolutely. I mean, there's no recourse, unfortunately, in the moment. But if you write to COVID Biz or call the call center line and say, this is the service that is, naming the landlord will help us figure out if it's a custodial service that's hired by the landlord, we can work that out with the landlord. But we respond to questions like that all the time, reaching out to service businesses that may not have employees who may not be following the masking guidance. So we can definitely follow up on that.
If there's a way to document it so that we have good evidence that it existed, a photograph, something like that, that really gives us the information to then move forward.
Absolutely.
Okay. Do you have any information about vaccines? And, there's all these news stories about when counties are going to get vaccines and vaccine distribution. Do you have any information about vaccines at this time?
So I'll start by saying that the plan to distribute vaccines is still in planning phases. They're still developing it at the state and local level. There is a chance that a limited amount of vaccine will come to Colorado in the near future. And if it does, it will be focused purely on hospital staff and emergency first responders. And it is unlikely to even be able to address all of that population. There is a plan at the state and county level, as well as to some extent guidelines from the federal level about how the vaccine will be distributed beyond that. But it's unlikely that that's going to happen in the incredibly near future. And my understanding is that as your, you know, the sector that you're in, or the risk level you're in, gets to the point of being able to get the vaccine, you will be contacted, and that will go forward. We're definitely getting a lot of questions from businesses saying, "Hey, can I get on the list?" There is no list. There is no order at this time about how that's going to happen. It is right now, we're still in the planning phase.
Okay, so there's a question about usage of conference rooms, and the particular building is using a conference room for children to do schoolwork for employees, and whether or not that's an appropriate use of the space and whether or not that can continue. I don't know if you can
Yeah,
comment on that.
I can answer it with a request to do a little bit more digging, I guess. The answer is that yes, a business can set up essentially a learning pod in a space at the business, and in that case, that space would then be under the learning pod guidance, and that is available on the covid19.colorado.gov website. I recommend looking at it. It is a very limited number of people, so yeah, it's it's very small. I really recommend looking at that, because that may not be possible in the space that they're talking about, or with the number of people they're talking about. And again, if that's occurring, we have staff here who are education experts, early childhood education experts, as well as our business team, who can try to dig into that in more detail.
Yeah, I believe the executive order around a learning pod was like 3 or 4 kids and a teacher. So
Yeah.
we can dig that up, but there is an executive order around learning pods that allows that to operate. So we can dig up that information. Let's see. Are there any other questions out there? I know that there's here we go. So in a multi-small suite office building, would tenants be allowed to remove their mask while in their office and the door is closed and they're alone?
Yes. So if you are alone in an office, 4 walls and a door, walls go all the way to the ceiling, all the way to the floor, and you have a door and you are alone, you may remove a mask. We don't recommend it because people come in and out doors all the time. Obviously, in a situation where there are 10% of the normal number of people in a space, that may not happen very often, but definitely it's possible. Just keep your mask nearby. Yeah.
But common areas, can you take off your mask?
Nope.
Even if you're 6 feet apart?
Nope.
Cubicles?
Nope.
What is considered an office space?
So an office space is, 4 walls and a door. 4 walls go floor to ceiling, and a door that can close. There are people with office bullpen spaces that the door can't close. That's not a separate office. There are people who have very tall cubicle walls, and even some cubicle walls that have doors. Some days I would love that for my cubicle, but that is also not an office or a separate office. That does not allow you to take the mask off.
I'm not even sure I know what this is, but what if it's a drop ceiling with a shared plenum?
I don't know what a plenum is.
It's the airspace above the drop ceiling. So we're still looking at an office. So as long as there's 4 walls that go up to that ceiling with a door, that's okay.
Thanks, Miss Elaine, you're on this call because I had no idea what that was. Thank you. So
there's one that I'm not sure if you saw. It was around evictions. And I don't have a lot of information, but we have had instances where properties have been designated as a public nuisance. These are more residential properties, and this has been pretty specific to the city of Boulder. But where we've had multiple issues, public health order violations, specifically like large gatherings where people are not socially distancing and not masking. We have designated properties as public nuisance. And so if there's any further issues at those properties, we would go to court and seek an eviction for those residents.
And yeah, I would just add that any of the eviction, moratoriums, that's a state level. I believe that's through the end of the year at least, that the eviction moratorium is in place. And that law has both, it's pretty clear, as well as it has exceptions and conditions on it as well.
So, and then the other, I guess, thing that could happen, I don't think it has, is if there's egregious, property violations, landlords that have rental licenses through like the city, specifically the city of Boulder, I know has rental property licenses. Those can be in jeopardy, that those people could lose their rental license. So there are some additional enforcement that could happen. We'd certainly like to avoid that. And again, we've encouraged landlords to reach out to their tenants to make sure that they are compliant, but because the property owner can be held accountable for their tenants' actions if they're unlawful.
I did see that question come in, and I was going to shift gears at this point to that particular issue. Are there any other questions out there? I think one of the things we were talking about, the four walls, taking off a mask. One of the things about break rooms, the reason that it becomes a dangerous location is because if someone's sitting down and eating, they're taking off their mask.
Yep.
They are, in that case, they're, participating in a conversation. We don't want them participating in a conversation or having that that dialogue with someone outside their household without a mask, unprotected. At this point, I'm going to see if do a last call for any questions. Again, there's a recording. I put the public health order in. We understand it's confusing. We understand that when you are a landlord and you have tenants that fall into 14 different categories of industries that may be critical businesses and non-critical businesses, that there may be a lot of things that you have to navigate. Please write down that covidbiz@bouldercounty.org email address. Ask your questions. Make sure that you get the answers. Call the call center. We're here to help. If you need to email me and I don't have the answer, I don't have a link to the resource, like the learning pod guidelines that I will send out as well. I forward it on to Jesse or to public health to get answered. So that's the point of this partnership. That's the point of us being there for our business community, to make sure that we're getting all the questions answered and we stay safe and we can get through this. We can fight the virus and get our businesses open. All right, that was last call. At this point, I'm going to thank both of you.
Thank you, Corinne.
I will see you both next week on Thursday at 1 o'clock. We'll see everybody in the next call, and as needed on Fridays at 11 o'clock. Have a wonderful weekend.
Thank you.
You too. Thanks, everybody.